here, what we know is that from the medical point of view, in order we to have a diagnosis, what we are doing as a medical professionals, we are trying to find, to collect a huge amount of available or not available at the moment data, while we are questioning, while we're examining our patients, while we're making our tests, our consultation, and afterwards we are analyzing them. Then we're making a synthesis, and in accordance to the knowledge, to the skill of the medical specialist, we have a diagnosis. But as I'm mentioning here, the diagnosis is highly dependable on the qualification of the skills and the time that the medical professionals could provide to the patient. And what we are observing nowadays, an increase into the demands and decrease into the medical specialists as a numbers. And therefore, the time is limited, and more of our colleagues are extremely relying on what the tests, the imaginary tests, the laboratory tests will do, but they do not enter into the details. What are the complaints? What are the symptoms? How they could be reached? And I think that here, the information communication technologies, the machine learning, and the artificial intelligence could give a huge support and impact on the diagnostic process. Because what we have till now, we have a symptom checkers for all the patients to do them. But of course, we have and the risk predictions that are already built, and they're supporting some of the diagnosis, especially into the breast cancer, into the prostate cancer. Nowadays, we have platforms that could be used. And unfortunately, a lot of our colleagues are not using them. They're saying, who cares? We do not believe to the machine. So therefore, we are trying to see, is this possible? Is this plausible for the medical specialists by their way of thinking? And what is more, the virtual coaching. There is no way a medical professional to spare such a time to coach the patient. They could give some advice. You have to follow this and this diet. You should not eat this. You should quit smoking, etc. But the virtual coaching is something that could not be given by the medical professional. So therefore, the objective is to analyze how our colleagues that are working into a Plovdiv region, and especially into the hospitals, do they agree to implement the information communication technologies? What we have done, again, the same survey. Now, 95 hospital medics. Why 95? Because, first of all, the inclusion criteria were from those specialties that are related to the pancreatic cancer. We were not questioning all the medical specialists that are working at hospital, but those that are working, that's a gastroenterologists, the general surgeons, the oncologists, the endocrinologists, etc. And of course, we were looking for those that are with a bachelor and master degree. Of course, we have in the PhD in our. Why? Because they are involved into the management of these patients. Again, quite the same, the questions as you could see, because we are out of time. I will just jump this gender distribution, the age distribution, as you could see, a lot of our practitioners are at the second part of their life. And here, this table is a little bit not a good one, because as you could see, the most of our colleagues that agree to participate are with less than 5 years. On one hand, it's a very good that the young specialists are willing to participate. They are looking for something new. But on the other hand, as you could see here, the distribution of the age, the biggest number of the practitioners are not accepting, and they do not even want to participate into such a survey. The results are given, and now what we have found. The good news, above 65% are willing, that they are accepting that the ITs could support their life. But on the other hand, not 40% of them are fully agree, strong agree. So they agree in general, but on the other hand, if they do not agree strongly, they do not implement them into their practice. So as a final one, we could say that they are admitting the plausibility with some doubts. And where are the doubts? The doubts are, they agree that they could have improved into the diagnostic possibilities, but on the other hand, they could not provide any support to their analytical issue. So at the end, I'm jumping all this just to spare some time. What we could say as a conclusion, that the medical specialists are admitting the artificial intelligence only as an assistant, but they do not rely on it as a supporter, as a machine, as the one that could provide a real analytical decision. So therefore, what we would like to present to our colleagues into our project, we are focusing on this uncertainty on the analytical potential. So therefore, what we will do to change this perception? When we complete the implementation, and we are implementing the iHelp platform into 500 patients from different age, from different practices. When we receive the results, we will have specific workshops with our colleagues to present the results, to have a discussion, and to try to change this perception. And what is more, into the iHelp project, we have extremely user-friendly decision support systems. They are very easy to be used by every one of the medical specialists. So we do believe that this will change the attitude, and the artificial intelligence will take its place into everyday diagnostic routine medical practice. So as we can see here, both the patients and the medical specialists are not full confident into the capabilities of the artificial intelligence. And now the third one is related to the primary health professionals, because they are the general practitioners, are those that are at our primary line. And could we jump to this and then to continue the discussion? Okay. So primary healthcare professionals. So now we are focusing this into this presentation to the pancreatic cancer. What is the pancreatic cancer? Something that is extremely rare, and something that is extremely subtle into the first symptoms and into the symptomatic. So therefore, as you could see, the first description of the pancreatic cancer was made in 1761. So into 18th century, till 18th century, there were no even an idea about this disease. And Morgani did the first one. Afterwards, almost 100 years were needed this disease to be categorized, to be laboratory detected with a microscopic by Mendes da Costa. And within another 8 years, treatment, surgical treatment was developed. Of course, here we have to speak about the Alan Whipple, who is, let's say, the father of the surgical treatment, but the first successful surgical intervention was done into 1937. So we could see that this disease is extremely difficult to be managed. And even today, the survival rate in 5 years, the life expectancy in 5 years is less than 5%. So why is this? Because it is extremely discrete beginning, and this lead to delayed diagnosis when the treatment is already ineffective. But what we have found that there are several risk factors, and these risk factors are associated even with the daily life, with the lifestyle, with the habits, with the fund consumption, and they could be easily modified if they are detected at the very beginning. But unfortunately, the majority of our healthcare providers, especially the general practitioners one and the registered nurses, do not pay any attention to these factors because they are very close to the other factors. And what is more, they do not have the sufficient time, as I said, into the previous one. So therefore, we need someone to support the general practitioners into what? Into the early detection. And early detection of what? Of the disease, of the diagnosis, or early detection of the patient at risk. This is what we need. Patient at risk to be detected, they to be stratified into 3 groups: low, moderate, high level of risk, and then we try to modify the risk factors if we could to eradicate them, or if not, we to try to decrease their impact. So here is the way, the place of the artificial intelligence. And what is more, we have, let's say, I have counted till now 1,200 publications related how the artificial intelligence could support different parts of the treatment and diagnostic process into the pancreatic cancer, and only 3 of publications were related to these procedures are accepted or not accepted by those that have to use them. So therefore, we made the same survey, and unfortunately here the number is not comparable to the hospital medical providers, because here only 57 of our colleagues agree to participate. And this is thanks to my colleague Vasil Topalov. He is a general practitioner and he used his own friends and relation to provide this number. What we have seen, a lot of the general practitioners do not accept, they do not care about these possibilities. Of course, the research statements are quite the same. The gender distribution, as you could see here, we have an extreme prevalence of the female, most probably because of the blue eyes of my colleague. I have no idea why, but this is probable explanation. Here is the age distribution. Once again, we could see the number of those that are the younger one. This is a good sign for us into the project. And as you could see here, the work experience is 10 to 30 years. So those that are really interested are those that have gained some experience and they do want to have a supporter. This is good news from the results again. And now almost the same. Very low, all the medics are fully confident to build a risk predictor. And if they do not agree that the artificial intelligence could build the risk predictor, of course, they will not accept the proposed by the machine programs for prevention and for consultation. And of course, but some of them are questioning all the possibilities, all the capabilities. So you could see here that into no one of the statements we have reached even 20% of full agreement. What does it mean? That less than 1 to 5 uh, 1 to 5 of our colleagues will implement the techniques, the machine into their practice. As you could see, in all the questions, we have this extremely low, strong agreement. So, on the overall prevalence, we have above 60% that they know that this could be used, but only 17% will use it. So this has to be changed. How? Again, the need is we to enter into the healthcare practice. We to present to our colleagues what they could do, how to do it, and then most probably this will be changed. And therefore, such a project as I help has to be more, uh, more frequently performed, and they have to reach a medical community. They should not remain into this audience. So with this, I will gladly